Dear friends, we all have experienced the impact of the COVID on people, businesses, and society at large. SRF Limited, being the socially conscious organization, tried its level best mitigating the COVID impact by initiating both preventive and curative efforts in different parts of the country. One of such efforts made with Narayana Health. At first, we have made some contributions to it to initiate preventive efforts here in Delhi. Thereafter, we have organized a couple of COVID vaccination programs, one at Gurgaon in Haryana, the other at Bharuch in Gujarat. Happy working with hospitals like Narayana Health. We wish it all the best. Thank you.
Hi, I'm Asha Dinesh, one of the trustees of Ashray Hasta Trust. We at Ashray Hasta Trust have believed in providing quality health care to the poor and the underprivileged, and we have always partnered with the NH CSR Trust to reach the poor community. During the Amphan cyclone, we provided certain care kits and food kits to the people affected in the West Bengal region. And we also recently partnered with them on a vaccination drive to be given to the labor community and the underprivileged. And our experience with NH has been really great. They are very honest, hardworking, and very compassionate. And this has worked us in the long run. I really look forward to doing more initiatives with them, and I thank them. Thank you.
As we are going through unprecedented challenges during the last 18 months, we have established a platform to ensure all employees and their families are provided a reliable and dependable means of support when in need. We have partnered with Narayana Hospitals, renowned for their dedication to provide the best and affordable world-class medical care. Many Saskians have benefited from these services. Since inception, Saskin has always donned the mantle of being a socially responsible corporate citizen. As part of our CSR initiative, Saskin is pleased to have contributed Rs 2 crores to NH Charitable Trust to part fund the 200-bed ICU facility being set up within the campus of NH Health City. All Saskians join me in saluting all heroes from the medical fraternity, doctors, nursing and support staff who have tirelessly worked to ensure those in need are provided the best medical attention and care. The Narayana Hospital Group, under the dynamic leadership of Dr. Devi Shetty, has stood out like a beacon of hope in these turbulent times. The team of dedicated doctors at Narayana, with the able assistance of other medical staff, have provided much needed care to patients who suffered from COVID and their anxious families. The selfless and tireless work at Narayana has been instrumental in the recovery of many people, including some Saskians. This gladdens us to no end. For all this, we shall remain eternally grateful. My management team and I and my colleagues join me in unison to extend thanks to everyone at Narayana for their excellent support and care. Thank you.
Second wave of COVID in India impacted every individual, household and community. It became clear that it will take all of us working together, both in the private and public sector, to tide COVID-19. Our mission at Microsoft is to empower every person and every organization on the planet to achieve more, and it has never been more relevant. We rallied together with our customers, government organizations and non-for-profit partners to use our technology, skills and resources to assist in the fight for COVID. Narayana Health has been a strong partner in this journey. Microsoft has long-standing partnership with Narayana Health Charitable Trust, and we're truly proud to partner with an organization that operates with trust and transparency at the core. We identified two areas to work together. First, in supporting the healthcare ecosystem to scale capacity with critical life-saving medical equipment, converting some of the existing hospital beds into dedicated ICU facilities in two of their hospitals, one in Gurugram and the other one in Bengaluru. The second area where we partnered with Narayana Health along with Give India Foundation was to provide vaccine shots for citizens with inequitable access to vaccination. We are really honored to stand together with an organization like Narayana Health, who pioneered affordable access to healthcare in India and is playing a very critical role to combat COVID-19 from the front lines. Thank you.
We salute all COVID-19 warriors, healthcare workers, doctors, paramedics, policemen, municipal corporation staff for being at the forefront of the COVID-19 battle to save lives even at the cost of risking their lives. Kotak Mahindra Bank, under its CSR project on relief and rehabilitation COVID-19 relief, has implemented numerous lives and livelihood saving measures during the entire COVID-19 pandemic. The second COVID-19 wave has been so severe that the death toll and the COVID-19 positive patients were significantly higher than the first wave. Hospitals and organizations were not able to take the onslaught of the COVID-19 patients at their doorstep. Kotak Mahindra Bank, under its CSR project, has funded and helped procure medical equipments, ICU equipments to hospitals and organizations across India to help them beef up their capacity. We have funded and procured medical equipments, ICU equipments, ventilators, etc. for Narayana Health Hospital, which is headquartered at Bangalore, to beef up their capacity. We truly appreciate Narayana Health management, doctors, the staff for working tirelessly round the clock to save as many lives as possible. We thank you, Narayana Health staff. We are truly inspired.
Greetings, Dr. Devi Shetty, healthcare professionals and members of the Narayana Health community. The COVID-19 pandemic has taken an immense toll on all of us, physically, emotionally and financially. The second wave in particular has resulted in loss of lives and livelihoods and has been a clarion call for all of us to come together to provide relief not just medically and economically, but also recognizing that we need to set up critical medical healthcare infrastructure for the longer term. Goldman Sachs, since the beginning of this crisis, has committed over 81 crores in providing relief and rehabilitation across the country. In the first wave, our focus was entirely on supporting communities, displaced communities, giving them food and shelter. In the second wave, we recognized that medical infrastructure was really important to focus on. To that end, we established and supported the establishment of COVID care centers, ICUs, high dependency units, including the 120-bed high dependency unit at the Narayana Health Center in Bangalore. Dr. Devi Shetty and all the fellow healthcare professionals at Narayana Health, a big thank you. And a big thank you to all of you healthcare professionals. You bear an immense burden and you carry it with grace and fortitude. For that, we are truly grateful. Thank you for this partnership in supporting this very important effort.
We are all passing through unprecedented and uncertain times due to the health pandemic that struck the world nearly 18 months ago. This has challenged both lives and livelihoods, and it is the timely support from both governments and other stakeholders that is helping communities and countries tide over the present crisis. I also believe that our hospitals, doctors, paramedics, pharma companies, healthcare staff and other frontline workers deserve our special gratitude and thanks for relentlessly fighting for us for the last 500 days. Given these circumstances, at Volvo Group, we too jumped in and extended outreach to the community by sourcing and donating life-saving medical equipment and resources and taking an active role in funding and operating a COVID care center in Bangalore. Friends, anybody connected with health and well-being will certainly know of Dr. Devi Shetty and his pioneering work in the medical field for decades. Indeed, Dr. Devi Shetty is truly one of the key architects of top quality healthcare in India. And from our experience with Narayana Health, especially during the crucial pandemic times, we saw that this institution is built on the principles of care and compassion, high quality, competence, and good ethics. We were therefore delighted with the opportunity to donate special ventilators to Narayana as a token of our contribution. We are partnering further on the initiative of mass vaccinations by repurposing a Volvo bus into a mobile vaccination unit. I'm sure, friends, together we can create a better healthcare system. All the best.
At JSW Foundation, we believe that a lot can be accomplished when we harness the power of collaboration and stand for nature as one. Saving lives and helping fellow Indians in our relentless fight against the pandemic is our top priority. Through our partnership with Narayana Health and Dr. Devi Shetty, we have facilitated a COVID care facility in Bangalore to bolster our medical infrastructure in this time of need. With our efforts, we are reaching out to geographies that need it to be most, so that every day can turn into a better every day for each one of us equally.
Hello everybody, I'm Dr. Saurabh Bhargav. I'm a urologist by profession and look after this Mazumdar Shaw Cancer Center. This is our old second floor general ward, which is still functional because we still have large number of patients. But this is soon going to be converted into a 110 bed intensive care facility. We are grateful to JSW for helping us with this. I will take you across to our area which is under construction at the moment. See, this is the part that is being constructed. There's full-fledged civil works going on at the moment. This used to be the second floor general ward, the half which is being now renovated. So once this part is done, then we will move the patients from the general ward to there, and the other part of this ward will start getting constructed. This used to be a physiotherapy suite, which has now been refurbished into a very, very nice high dependency care facility, and all the support for this has come from Intel, and we are extremely grateful to them for this. I will take you for a little walk. We'll move on to the wards. There are several of these wards. These are isolation rooms, so these are negative pressure rooms where you can keep patients. They are fully equipped and ready and run. They can be up and running in like 2 days' time. This is a typical ward on this unit. We've got plenty of open space. It's very well lit. I hope the third wave never arrives, but if it does, there is no doubt in my mind that the NHL City is extremely well prepared for it this time. Thanks.
COVID-19 turned our world upside down. 1.5 years ago, none of us heard of what COVID-19 was. When it really struck us, we had no clue how to manage COVID patients. We had no idea how it is going to affect the patients as well as the treating doctors, nurses, technicians. There was fear all over the world. But amidst all this confusion, fear, chaos, one thing became very clear. We realized that in this battle against COVID, we are not alone. Society is backing us. Our ICU was full. There was no ventilator. There were no syringe pumps. There are no adequate medicines. And of course, there are very few people to take care of them. Thanks to all the donors, we could virtually double the number of ICU beds, virtually double the number of patients we could take care in every hospital. That was only possible because of the generosity of the donors. I'm sorry I won't be able to name each one of them individually, but they're all wonderful human beings who reinforced our belief that the fight against COVID, we are not alone and the society is with us. We are extremely grateful to all the donors who have helped us to enhance our infrastructure, stood by us, helped us with every step we took in our fight against COVID. Once again, on behalf of NH organization, on behalf of all the patients who are benefited, and on behalf of the society, we want to thank all these donors. We are extremely grateful to you.